Hello, my name is Dr. Ursula and I'm the head physician of the original Mayr medical resort in Austria. Increasingly, we encounter so-called weekend or 4-day gut resets. The concept is appealing. Take a few days out, reduce food intake, and afterwards the gut is supposedly restarted. From both clinical experience and a physiological perspective, however, we're not convinced by such short formats. Not because a brief pause has no effect, but because the processes we intentionally initiate in the Mayr therapy require more time. The body is not a system that fundamentally recalibrates within 48 or 72 hours. When food intake is reduced and structured, the first step is metabolic adaptation. Glycogen stores are gradually depleted, insulin levels fall, and the body begins to shift from carbohydrate metabolism towards fat oxidation. Only after several days can a stable state of ketosis develop. At the same time, the initial intestinal relief initiates cleansing processes. The gut responds, the internal milieu begins to change, and previous fermentation patterns start to resolve. This phase is often accompanied by transitional reactions. The body is working, but it has not yet reached stability. As relief progresses, further mechanisms begin to unfold. Autophagy, the body's cellular renewal and recycling process, is activated. Inflammatory burden can decrease. The automatic nervous system begins to settle. Many individuals report the benefits they were hoping for from a reset only after several days. A mental clarity, steady energy, a calm abdomen, improved sleep. These effects rarely appear on day 1 or 2. They tend to emerge around day 5 or 6, once metabolic adaptation is genuinely established. And this is the crucial point. A weekend program usually ends precisely when the body is just beginning to reorganize itself. The Mayr therapy therefore follows a clear and structured sequence. It begins with a medical assessment and a dietary consultation on which the individual diet level is based. We very often start somewhat more strictly in order to provide a clear regulatory stimulus. This is followed by the phase of metabolic adjustment and intestinal relief. Only thereafter does the structured rebuilding phase begin. The gut is not merely relieved, it is gradually rebuilt. Nutrition is carefully adapted, tolerance is assessed, and new habits are introduced. Conscious chewing, structured meal times, adequate pauses, mindful eating. These require repetition. It's no coincidence that we recommend a minimum duration of 7 days. Many guests stay for 10 days and continue the program at home up to day 21. This time frame corresponds not only to metabolic adaptation, but also to the period typically required for new behavioral patterns to become established. Stability arises through repetition, in metabolism as well as in lifestyle. A 3 or 4 day program may provide an initial impulse. Sustainable regulation of the gut, metabolism, energy levels, and mental clarity, however, requires more time. The Mayr therapy is therefore not a short format.